So we are incredibly grateful to all of the healthcare providers who have taken time out of their weekend to volunteer and educate sarcoma patients and caregivers on critical topics related to sarcoma. At the Sarcoma Alliance, we believe that our peers can also be some of our most powerful teachers. This year, we wanted to try something a little different, a patient panel, because we know that the wisdom gained from firsthand experiences can provide support and invaluable lessons. So with that in mind, it is my honor to introduce Meredith Berger, patient coordinator at Wendy Walk and one of the exchange co-hosts. Meredith will be facilitating our patient panel today. Meredith, thank you for your dedication and efforts to bring this panel to the exchange. We're so excited to hear from you and our 6 incredible panelists who have graciously agreed to share their insights with us. Meredith, I will turn it over to you to welcome our panelists.
Okay, thank you, Julie. And we're actually, Zachary couldn't make it, so we're going to have 5 panelists. Something came up, but as patient care coordinator at Wendy Walk, I have the opportunity to connect with so many amazing and inspiring people. So today, sorry, just some of this gets me really emotional. Today, we are so fortunate to have Ashley, Brandy, Seth, Julie, and Christina on our first patient panel at the Sarcoma Exchange, and it's actually my first panel, so please bear with me. We're going to start with intros, and then I have one prepared question on some of the topics that we talked about yesterday and today. Please put any questions in the chat. If there's time, we'll address them. We'll also be sharing how you can get in touch with our panelists. And so we're going to start with Ashley, who's going to do a little intro. So we're going to ask, she's going to tell us about her diagnosis, her doctor or hospital, her current status or treatment. She's going to share, and then we'll go through each person. I'll queue it up, and then we'll go into the questions after. So Ashley, if you want to introduce yourself.
Yes, hello. Can you guys hear me okay? Awesome. I see some familiar faces on here, and it's making my heart so happy. Hi, Brandy. Hi, Christina. So nice to meet you guys. I am so honored to be here. I love Meredith. I recently put out a small poetry book about my cancer experience, and Meredith was there, and I got to meet her and my lovely husband in person, and they are just so great. So it's an honor to be here today. I was diagnosed with sarcoma towards the end of 2020, and it was a spindle cell rhabdomyosarcoma tumor that was right under like my collarbone. And I started immediately with the oncologist that I had through my insurance. But because of the rarity of the disease and just the lack of experience most people have surrounding sarcoma because it's so rare, I ended up moving from doctor to doctor until I found Dr. Sang on Instagram, which is crazy and a really wild story. I'll get into that a little bit more when we talk about the question that Meredith presented me on second opinions. But yeah, that's a little bit about my story right now. The sarcoma is gone. I've been NED, no evidence of disease, for a couple of years, and I'm a part of the remission study for people in their 20s who've gone through cancer at City of Hope. Yeah, and that's a little bit about me.
Great. Thank you so much, Ashley. Okay, next up is Brandy.
Thank you so much for having me. My name is Brandy Baranowski. Hi, Ashley. Ashley is actually somebody that I reached out to on Instagram when I was looking for help. But I live in Northern California. I was diagnosed with uterine leiomyosarcoma in November of 2021. And at that point was immediately referred to a gynecologic oncologist. I'm actually a registered nurse, and I worked in the operating room. And so I had heard the word sarcoma before, but that was about it. So, the word wasn't completely foreign, but that was the extent of what I knew about it. And I didn't realize that the gynecologic oncologist was not the right doctor for me to be seeing, especially because I didn't have a uterus anymore. But I got a lot of opinions and ended up getting some treatment at MD Anderson. And then a little bit closer to home at City of Hope as well. Dr. Sang actually was the surgeon who removed the tumor, who took the risk that other surgeons weren't willing to take. And so, very aggressive. I didn't respond to chemotherapy, stage 4, grade 3. So I realize how poor my prognosis is, but later this month, I'm celebrating a year with no evidence of disease. So very grateful to be here.
Thank you. Thanks so much, Brandy. Okay. Okay, Zach is not here. Julie? Yeah, welcome. Oh,
Can you guys hear me okay? Awesome.
Yep.
Bear with me with my voice. I'm a little under the weather, so thank goodness this is virtual. Wendy Walk and Sarcoma Alliance, thank you so much for having me. It is definitely a privilege to be here to speak. So to start off, my name is Julie, and I was diagnosed with stage 4 high-grade, poorly differentiated synovial sarcoma of the lung. I was diagnosed at age 23. I'm 33 now, so that was 10 years ago. So there's been, a lot going on in between then. The initial tumor was a 20 centimeter wide tumor compressed against my left lung. The diagnosis, I was given 3 months to live. And I just had to get started with treatment right away. I was treated at Penn Medicine's Abramson Cancer Center in Philadelphia. And I had a lot of doctors, as most of us probably do. So my oncologist was Dr. Staden, which has since retired. So now it is Dr. Hartner, Leticia Simmerol. I also received, and then they were the ones that conducted the chemotherapy for me. I also had a thoracotomy to remove the lung and some ribs and some veins and some nerves. And that was done by Dr. Singhal, also at the University of Pennsylvania. Wonderful, amazing surgeon. And then I also received the 36 rounds of proton therapy at the Perlman Center for Penn Medicine. And since that was the initial treatment plan. And following my 3-month scan after I was NED, after the initial, full 365 days of treatment, the cancer came back in my left lung. It was a small nodule, which had to get removed surgically through the VATS procedure, the video assisted thoracic surgery. And then I was good for about 1.5 years. And then in 2016, right before I was about to start college again, it came back, 1 nodule in each lung. One was performed again by the VATS procedure, and then one was treated with CyberKnife again at the University of Pennsylvania, and that was by Dr. Nagda. As you all probably can relate to, it takes a whole team, and I thank my team and my nurses. Pretty, it's a lot. It's a hard job. So I mean, kudos to the nurses that can do this, and it's a lot. But since then, like I said, the diagnosis was about 10 years ago, and I have been no evidence of disease for 8 years, and that is after the initial diagnosis and 2 recurrences. So I feel extremely blessed and extremely fortunate to be here, still alive, and able to talk to you guys after all of that.
Thank you so much, Julie. Okay, next we have Seth. Seth, welcome.
Hi, thanks for having me. Can you guys hear me?
Yeah.
Okay. Kind of have a bit of a cough, but
Okay.
my name is Seth Quinn. I was diagnosed in 2020, really. I had like a tentative diagnosis before that. Turned out to be a benign tumor. And then the diagnosis was in my knee of another tumor, like basically on that other tumor. So who knows? And then I had surgery to remove that, and it was good, like positive margins. And then 9 months later, we found on some scans that it had spread to my lungs and like little nodules. And so it's kind of just like all in my upper body around. And I did AIM chemo for 6 months, and I've done like Votrient and another clinical trial. and now I'm doing just ifosfamide for 6 rounds. And so I'm on going into round number 5 this month. Yeah, I get treated at UCLA by Dr. Singh, and he's been my oncologist for the whole time. Did I miss anything?
Yours synovial?
Oh, sorry. Yeah, synovial sarcoma.
Yeah.
That's what I have.
Yeah, well, thank you. Thanks for joining us, really. Okay, we'll be back with the questions. So last but not least, we have Christina.
Hi,
Welcome.
thank you so much to Wendy Walk Sarcoma Alliance for having me and for everybody here. I'm also feeling a little emotional just getting to be in a space with people who really get it, who understand sarcoma. So a little bit about me. I was diagnosed with a rare subtype of sarcoma called a desmoid tumor. It occurs in about between 2 and 4 million in 2 and 4 in a million people. I was diagnosed in 2018 after being misdiagnosed and treated for a year for something else. But I'm going to echo Julie's shout out because I'm also a patient of Lee Hartner at the University of Pennsylvania and Leticia Cimarron, and they're wonderful folks. Highly recommend them if you're looking to get into a second opinion. So I was diagnosed in 2018, and I had been on just about everything out there for desmoid tumors. While they are defined as intermediate grade soft tissue sarcomas, which means that they're unlikely to metastasize traditionally, they are very unresponsive to surgery. They recur about 60% of the time. So we wanted to take every available opportunity to try all of the drugs out there. But thankfully, here I am in 2004, and my tumor has been stable for the past year and a half. And that is the continued goal of my treatment. And I'm so grateful that I can finally say I'm in a place of stability.
That's great. Thanks, Christina. Okay, so now we're going to circle back to Ashley. And so her questions on the topic of second opinions at Sarcoma Center. So here we go, Ashley. Can you tell us how you went about getting a second opinion at a Sarcoma Center and how it impacted your treatment plan and ultimately your health outcome?
Yeah, I think in the immediate diagnosis, it's so hard to even think through those things. There's so many questions being thrown at you. Being young adults, you're like in the middle of your job or college. I just graduated at the time. And so I think I was just kind of like, okay, let's just get the treatment done and do whatever you need to do, and we'll just keep going. But when the treatment option was like a 4/4 amputation, which is not just the removal of your arm, but like all the way here, I again was like very quick to be like, okay, let's do it. And it was my friends and family that were kind of encouraging me to get second opinions at different places. And that's when I found Dr. William Sang through Instagram, hashtagging sarcoma to try and find people that knew about sarcoma because I was at a loss. I remember it was so crazy. I was emailing people, DMing people, like anyone that would take my case. I would try and have them look at it. And so Dr. Singh was willing to do that. He did a limb sparing surgery for me that resulted in the entirety of my tumor being gone, even with a nerve cut that my family and friends had to make that decision. My super sweet sister made that call if we wanted to like leave half the tumor or cut a nerve and take it all out. And she was so brave in saying that I'd rather have it all out and cut the nerve, even if I lost some control of my arm, which is exactly what I would have wanted. But I ended up having full function of my arm anyway, which is great. I had a lot of like physical therapy that I had to do, but ultimately like can barely notice now. And then Dr. Sang was the one that recommended me to the Sarcoma Center because Dr. Chawla and the Sarcoma Center had more experience with rhabdomyosarcoma and doing clinical trials versus the place I was at before was just doing the regular standard of treatment. And my tumors were completely non-responsive to the treatment that we did. And even at one point, I was hospitalized for a few days doing like the most intensive chemo that they could put me on. And it didn't shrink at all. So this was kind of our way of trying something new. And so I do recommend, especially with sarcoma, that people get second opinions, that they reach out to other providers like USC, UCLA, MD Anderson, whatever is local to you in your area, especially with sarcoma. Being in the sarcoma community now, I know friends who've been misdiagnosed, and their misdiagnosis led to being treated, like Christina was saying, for the wrong thing for a long time. Sarcomas can even appear benign sometimes when they're not benign. So it's very important, I would say, when you're dealing with a rare disease to get the opinions of several different experts so you know that you're moving in the right direction. And that's something that I really encourage people to do now. Instagram has been a big way for me to connect with the sarcoma community, and WhatsApp too. A lot of different people have reached out on that. And I think it's just important that we encourage each other, because some of the most difficult parts of having cancer were the administrative sides of having cancer, like being on the phone with insurance for hours and hours, and doctors, and being on hold, and having to deal with, the emails and the calls and all of those things. It's very difficult to work through the medical system. So I always try to offer any support I can, and I've been really grateful to get that support from so many in the middle of it. So that's kind of how I went about getting a second opinion. I was through Instagram, through finding kind of different contacts globally through social media. I actually was at Dr. Chala's office one time, and this girl comes up to me in the waiting room, and she's like, "I know you from Instagram. I follow you," because she also clicked on the hashtag rhabdomyosarcoma. There's not that much, under the hashtag. And so I think it's important that we communicate, stay connected, and educate each other, because it can feel so isolating when, sarcoma accounts for 1% of cancers, and there's just not a lot of education out there. So thank you, Sarcoma Alliance and Wendy Walk, for making this panel and letting us share a little bit, because it's very hard and very awful. I was getting so emotional hearing all of you guys talk, because I just want all you guys to feel good and feel better. And it's a journey I don't want anyone to have to go through. And I think if we can identify, diagnose quick, before, it gets metastatic and before spread, then that's, the best possible outcome. So yeah, definitely big on second opinions and getting advice from as you can, so that you're on the right treatment path.
Thanks so much, Ashley.
Yeah.
Okay, next, Brandy's going to speak on the topic of the importance of multidisciplinary approach when dealing with a sarcoma diagnosis. So my question to Brandy is, can you share how different doctors or specialists, perhaps from different facilities even, work together to help guide your treatment plans, and how you feel that benefited you?
Yes. So I was treated, I got opinions at a lot of hospitals, but I was treated at 3 different hospitals. And I want to clarify that the first doctor that I saw, being a gynecologic oncologist, was not inherently wrong, but the fact that this hospital, which I'm not going to name, had a sarcoma center, and nobody on my team thought to consult the sarcoma team at the hospital I was being treated at. And I didn't know any better that I should be asking for a consultation with a sarcoma specialist. I just assumed that the doctor I was referred to was the doctor that I needed to be seeing. So I went through gemcitabine and docetaxel. I did 6 rounds of that. My tumor doubled in size. And before that happened, actually, the gynecologic oncologist had gone in to remove my ovary. And this was after my initial hysterectomy. Then she had gone in to remove my ovary because I had estrogen receptors on my tumor. When she got inside, she found about 6 metastatic implants throughout my pelvis, and she removed all but one of them. And that one little implant that she left behind grew to an over 12 centimeter tumor that fused to my bladder, my colon, and the left neurovascular bundle in my pelvis. She said that she had left it behind because she didn't want to damage my colon. And if she would have just taken it out, I wonder if I would be where I am today. So anyway, I don't want to get down the path too much of a second opinion because that was Ashley's topic, but I did end up going to MD Anderson, and then that doctor I'd been seeing stopped returning my phone calls. I ended up getting 25 rounds of radiation at MD Anderson, and this was a whole different experience for me because I showed up, I saw the medical oncologist, I saw Dr. Raveen Rattan, and he introduced me to this new concept where he was going to take my case to a tumor board. And I, oh, what a concept. And at that point, I learned that there was a radiation oncologist who treated just sarcomas there at MD Anderson. And she was hopeful that some radiation would help me. So I relocated temporarily from California to Houston, got the treatment there, and then was supposed to return after the holidays. So I had finished radiation just before Thanksgiving in 2022, supposed to come back in January to have this tumor removed. And when I showed up in Houston for my surgery, the surgeon told me she would not be performing the surgery, that my tumor looked like it had grown and that she was no longer comfortable operating on me. So I panicked at that point. I thought that was the end of my story. And then my medical oncologist, my sarcoma specialist, came back and said, hold on, we're gonna reconvene with the tumor board, and we're gonna see, what we really think is going on. And then once this team of doctors came together who specialize in sarcoma, looked at my films, looked at my case, looked at the treatments I'd been through, decided, well, you know what, we don't really think it's growing after all. It might just still be inflamed from the radiation. And so it's just a huge roller coaster at this point, the lowest low and then another high, thinking, oh, wait, maybe it's not growing. So during that time, they had decided they wanted me to just wait a while and come back again. It was 6 weeks to repeat scans and then reevaluate whether or not I was a candidate for surgery. But during that time, I got opinions at several other cancer centers throughout the US. And I don't want to discount how fortunate I am that I was able to make that happen. But I ended up finding City of Hope, and a little bit closer to home for me. I still have to get on a flight to get there. But I went down there and I saw Dr. Mark Agulnik, who is he is one of my primary medical oncologists now. He also brought my case to their tumor board, and turns out that Dr. William Sang, the same surgeon who helped Ashley, I had been following him on Instagram since my diagnosis and never put two and two together. And he ended up being the surgeon who offered to take the risk. So he had to assemble a team of 5 different surgeons. There was a colorectal surgeon, urologist, gynecologic surgeon, and a vascular surgeon, in addition to him being, the surgical oncologist, worked on me for almost 14 hours to remove this tumor from my pelvis. So I now have a colostomy. I also have a urostomy. And I'm doing great. But I really just think that, it's so important to go to a place where there's a team of people. You want more than one set of eyes looking at you. You want doctors who have experience treating sarcoma. And 3 months after, well, it was more like 5 months after my surgery, I went back for repeat scans, and the cancer had recurred. I had a nodule in my lung. And my oncologist, Dr. Golnick, immediately said, you know what? It's okay. This nodule looks like it's been there for a while. It's just grown a few millimeters, but we're not going to stop. We're not going to wait around to see what it turns into. I'm going to send you over to our chief of thoracic surgery right here at City of Hope. He has experience in sarcoma, and we want this thing out within the next 8 weeks. And so I had a VATS procedure, just like Julie did, and I've been cancer free ever since. So it's really important that you're going to a place where people are collaborative, where they're not going to stop returning your phone calls if they see that you get another opinion. And that you would just really feel cared for, that they're working together. I live in Northern California, and I still fly down to LA for all of my care because they just made me feel like they have my back. And I think that's important for any sarcoma patient to have that same feeling.
That's great. Thank you. Thank you for sharing that, Brandy. All
Thank
right.
you.
So I actually went out of order last time, Julie. So actually, Seth, I'll let Seth talk also because maybe he's not feeling so well. Seth is going to speak about the importance of mental health and exercise. And so I'm asking him, can you share your personal experiences that highlight the impact of exercise and mental health support in your sarcoma journey? So Seth, whenever you're
Yeah.
ready.
Yeah, the first 6 rounds that I did of AIM chemo, I wasn't like able to exercise a lot, and that's really big for my mental health. It's also, I think it really helps with how you go through the treatment. You know, if your body is weak, it's just going to take everything so much harder. And if you can do really whatever you can do, like now at this point, like I'm a little bit injured and fatigued, so I take a lot of walks, and it really helps. And it's, I don't know, in a lot of different ways. It helps your circulation through your whole body. So, you know, when you're hooked up to a bunch of IVs and stuff, that stuff goes through you rather than just kind of like making you swell in certain areas or things like that. If you can just move around, those things won't happen as much. You don't, I tend to think that I don't feel the effects of the drugs quite so hard if I'm able to move around. And it's kind of a thing where fatigue leads to fatigue. And I know fatigue is really difficult to get through, or just, you know, you're not feeling well. And it's important to listen to your body and not overdo things. You know, your body's already expending energy fighting all these different side effects. But it's also important that when you can and are able to, that you do try to move around and exercise. And it doesn't have to be, you know, a HIIT workout. It can just be, I mean, like I really enjoyed surfing. So when I was able to, I just surfed as much as I could, really. And other than that, you know, I would take walks or just try to do activities, even like participate in life in an active way. You know, if you're gonna hang out with a friend, go do something rather than just sitting on your couch if that's possible. And for me, it really helped my mental health, especially like I'm in the hospital for 7 days at a time during my chemo. And that can, one, is just really boring, and two, you're in a tiny room for 7 days, which is kind of insane. And walking through the ward and stuff, you know, I have like my big pole that I'm like pulling with me, is really helpful. It just gets you out of the room, out of the bed, and kind of just changes your environment. It's easy to get stuck in the same environment all the time and kind of create those negative associations. And if you can break that up, that's really helpful, I've found. Another thing is just trying to prevent those negative associations from building up. That's a lot of, and it's with everything, you know, food, the people you see, you know, your nurses, things like that. Try to feel the way you want to feel about things rather than, you know, if you're feeling that you can't eat a certain food or something, you might take a little bit of time to work on building positive associations with that. Like just thinking, taking whatever it is that you don't like in your head and trying to hold it, and then also trying to embody the feelings that you want to feel. Like for me, I couldn't even smell like salmon, make me nauseous after I ate salmon in the hospital once. And so I spent a lot of time just like thinking about salmon and being like, you know, like feeling of hungry, you know, confident, feeling just good, even if not like hungry, but just like good. And also having salmon as a part of my thought. That was really helpful. I can eat salmon again. So like it worked. But that's a really small example. But it works for, you know, a lot of bigger things too. And it works in degrees. So it's not an all or nothing thing. I guess also just having some kind of mindfulness practice or meditation is really helpful. So a lot of the time, the stress of what I'm doing or all these different things, insurance, doctors, switching, and you're like switching treatments and you don't know what's happening to you. You don't know what's going to happen. That stress can be just as detrimental, like, to my life and how I'm feeling as whatever my tumors are doing. A lot of the times, I mean, at certain points, much more so. And so being able to stop and be like, okay, how am I really right now? In just like this 1 second, I'm actually okay. It's just all this stuff that's happening that I'm thinking about in the future or the past or something that's making me feel how I don't want to feel. Being able to acknowledge that has been really helpful for me.
Thank you. Thanks so much, Seth. That was great. Thank you. Hope you're feeling better. Okay. Good. Julie. So Julie is going to share her thoughts on the topic of managing financial burden of a sarcoma diagnosis. So Julie, can you tell us how the high cost of your care impacted you, how you managed, and can you share any specific resources and advice to those struggling financially?
I can do my best. This is such a I feel like complex topic because it differs for everybody, really. And I actually just saw Leslie's message. Thank you so much, Leslie, because this kind of is in relation to the caregivers. Unfortunately, and it's such a burden, and I will, oh my God, the caregivers of the world, like, thank you so much. So my, financial toxicity started right away when I was diagnosed, because when I was diagnosed, I had no insurance. I had no health insurance at all. I was 23 years old at the time, and I wasn't on my parents for, whatever reasons, divorce and all that stuff. So I was your carefree 23-year-old. I don't need health insurance. I'm not going to get sick. So here I am with stage 4 cancer, 3 months to live. And I just remember my parents endlessly on their laptops in the hospital room, phone calls night and day, trying to get me medical coverage. We finally did. I believe I got Medicaid. I can't chemo brain still. But I think that's what it was. And bear with me as I kind of scan through my notes on this topic, because financial toxicity in the cancer world is just, it's a lot. I will stress that if it is available to you, and I know, again, everybody's situation is different, but I want to stress this because it's so important. If you as a patient are able to delegate the phone calls and the finances to someone who can advocate for you and fight for you, please do, because it's a full-time job in itself, trying to fight a cancer, trying to fight a sarcoma. It's not just your typical cancer, it's sarcoma, and it can be ruthless. And it is so hard to go through that in itself. And then addition to that, you have to worry about the finances. You have to worry about what's going to be approved by insurance. Is your insurance going to cover this? Do I have to go through this, hospital that I don't want to go to because my insurance covers this, but not the good one that I want? Like, you shouldn't have to deal with that. So if it is available to you to have someone, a friend, a family member, anyone that can advocate for you, please try to do that, because I feel forever fortunate for, my mom was she stopped working and was my caregiver, and it was very hard on our family, but she's a fighter. She is ruthless, and she really laid into the insurance companies. I mean, I was with her almost all the time when she was on these phone calls, and she just never took no for an answer. All of my treatments were declined more than once. My chemo was declined. My surgery was declined. My proton radiation was declined. They said I could get the a regular radiation. My CyberKnife was declined. My VATS procedures were declined. Everything was not approved by my insurance. And thank you to my mother, who is a crazy, crazy woman fighter, and working with the case managers at the hospital, which I also recommend. Everyone working together for me is what allowed me to still be here today. So if you can find a fighter for you, please do it. That is what I would recommend, because it's so hard to do this on your own. You can't. You have to let people help you. And I know that's another really, really hard thing to do, but you have to let people help you. And like I said, I do know that it is very different in wherever you're at in life. You know, I was younger. I was still kind of living at home at the time. Like I was closer with my parents. So it depends on what your situation is. But if you have that available to you, I would recommend doing that. The cost of it is absurd. I mean, I'm not sure about the other panelists, but it is very costly. I think everything together for me was at least $3 million. And they have no problem with declining you. You know, I remember my mom specifically on the phone with an insurance company, and she told my mom, she was like, "Ma'am, we just declined a baby that needed, you know, proton radiation like this morning." And my mom, it's just, you don't have the time if you're fighting and you're in treatment. Brandy even said it, like you're going through treatment, your mind is not clear. I feel like someone is not capable of handling the abundance of phone calls and back and forth with insurance that it takes in order to get things approved. So you need to fight, and you need to not take no for an answer. And if you can have someone fight for you, please do so. And that's where a lot of the burden falls on the caregivers. And it is really hard to watch, you know, your loved ones suffer, and then the burden is on you to try to figure out how to help them. And it's an overwhelming experience for everyone involved. And it's just, there's no way of making it better. We all understand that it's extremely hard, and we try to get through it the best way we can. But people shouldn't have to miss out on certain treatments or certain care or certain doctors based on finances. You know, I did not have insurance upon diagnosis. I am not in medical debt now, and I'm fine, and I've been NED for 8 years, and you find a way to figure it out. You work with people close to you, and you find a way to just make it work and get you the right care that you need. And it just try not to, it's like finances. It's like, try not to let finances be too much of a burden. Just put your health first. Make sure you're taking care of yourself first, and then everything else can be figured out. As far as resources goes, I mean, it's not necessarily a specific resource for finances, but I love the Sarcoma Alliance support group on Facebook. I love that group. Everyone is so informative. They're so helpful. And it's great because a lot of times when you're looking for certain resources, it's based on your geographical location. So I do know that, you know, you can share, hey, I'm in this area. Sometimes people will have the same doctors as you. Sometimes they'll, you know of a grant program that they're able to provide to you as well. I do also know, like, cancer support community.com is also a good website. They have people on call that you just share your diagnosis and where you're located, and they'll find specific resources to give to you based on like what your needs are. You can say, I need financial help. There's people that will have lodging. There is people that will have transportation to and from appointments. And there are things that can be figured out for you, and you don't have to suffer alone. Brandy and I believe Ashley also mentioned the power of social media is a beautiful thing within the cancer community. I am so for it. I love the cancer community online because it is very helpful, especially with that Sarcoma hashtag. There's not a lot of us, but a lot of us there are very helpful, and we're very supportive, and we want to help people that are going through what we went through. So please, like, check your Instagram, check your Facebook, check Twitter, whatever it is. Reach out to the people that have gone through what you went through, and I promise you they'll want to help. They will want to help. We're in this together, and we want to make sure that we're alleviating the stress on each other as much as we can. So no matter what, even though you are in a situation where you feel alone, you don't have the family support, you don't have the friend support, anything like that, you're not actually alone. You have us. Just look for the hashtag. So,
That's great. Thank you so much, Julie. Thank you. That was great. Okay, so Christina, so Christina's gonna talk on the topic of emerging therapies and clinical trials. Can you share your experience going from compassionate use in a clinical trial, and maybe not everyone understands what that is, to becoming an FDA-approved, fully prescribed patient, and include any tips on navigating or navigating?
Absolutely. So I'll spend the first few moments catching us all up here on what those terms mean, compassionate use and expanded access. Basically, what that means is that you are getting your own protocol that's delivered to you from your oncologist so that you can access a drug that is within trials without the risk of getting the placebo. So with my diagnosis, a desmoid tumor, I had been on 4 different kinds of treatment in the first 3 years, and there was no standard of care at that time developed for desmoid tumors. So if I were to enroll in a clinical trial, the risk of getting the placebo would be what I was getting if I was not getting the actual drug. Whereas if you're going into an FDA trial with another drug, with another diagnosis for which there is a standard of care, you're either getting this new improved drug or you're getting the standard of care. And I was quite concerned about ending up with a placebo because there was no developed standard of care at that time. So thankfully, my oncologist was willing to write this protocol for me so that I could enter a study of 1 with no risk of the placebo. And what I want to emphasize is that it is so anxiety provoking for all of us to just think about these risks, to think about not only what does it mean if this drug doesn't work, or okay, this drug works, but then what happens if it gets approved? Will I lose access to it? So I will say that everything comes down to, for me, choosing the right care team, choosing the right people to have in your corner. Because at UPenn, I had the right people in my corner. They were up to date on all of the latest research that I was. So when I went to them and I said, hey, these side effects that we've been tracking, they're not sustainable. We've been through all these different treatments within 3 years. I don't qualify for this current trial. What are the alternatives to me? And that's when they explained compassionate access. So I was on compassionate access from the start of my individual protocol, which was July of 2021. And what was most exciting is that I was on the drug when it got approved this past December in 2023. So no longer in the desmoid tumor world is there no standard of care. There is a standard of care, and it is the drug that I'm on, which is under the commercial name Ogsiveo, or nirogacestat is the more commonly used formulation name. As I mentioned, my care team made it really easy. I recommend keeping in touch with your networks. Here we are, Sarcoma Alliance. Good on all of us for being here today, as well as Wendy Walk. If there is another patient advocacy group that works specifically with your subtype, you can also look at them and see when these things are coming down the pipeline. I had heard wind that Ogsiveo would be approved for commercial use, but I was really nervous. Like, what would happen if it was approved, but I didn't have my medication? And they made sure that was all taken care of for me. So my appointments would typically go like, I'd go in, I'd get my EKG, whatever testing I needed to have done, my labs would be drawn, and then I'd be dispensed the medication that was shipped to UPenn for the purposes of compassionate access. Once it looked like we were getting close to approval, and the pharmaceutical company was only producing a smaller amount because they knew they were moving into commercial use. They said, hey, we can only dispense a month at a time as compared to 3 months. So they made sure I was up to date on getting those every 3 months, even though that I didn't have my appointment sooner than every 3 months. And they also had me fill out paperwork. So my number 1 tip for anybody who's looking to move into commercial use, check your email. If you are one of those people for whom those messages come through the MyChart and the portal, stay on top of that as much as possible. Ultimately, it worked out to me getting that email and kind of hopping right on it, filling out that paperwork, submitting it to my oncology team. Something to remember is that it makes sense for the pharmaceutical company to keep you on the medication. Once you're on the medication and you are quite honestly a success story, I consider myself a success story because this, grapefruit-sized tumor hasn't gotten any bigger. they want to keep you on it. So make sure that you get to them with any issues at all, if need be. You're also going to be given a bridge prescription to keep you covered until your medication arrives. So for example, they might do an initial prescription release to your home. It's usually shipped to our home with a specialty pharmacy, like most of us in the sarcoma have to use. We can't go right around the corner to get our meds if we're on an oral chemo. And that bridge prescription will make sure that you have several months, if it's anticipated, that it will take a longer time as they move to any other commercial production sites, et cetera. Once you're on commercial use, it's kind of bananas how quickly it goes from being such a special use drug to how it becomes like getting any other drug that is shipped right to your door. So that's another example where you just want to stay on top of those emails. I know they can pile up. Stay on top of those, stay on top of your voicemails, and make sure that they have all the information they need from you. If at any point you feel like you are not getting your deliveries on time, that's information that your care team will want to have and your research team. But I have to truthfully say that it was by far the easiest part of the whole process for me, just to stay on the label and stay on the drug. My true hope is that all of us will be in a place where we get that type of one-on-one support. But I will say that if you're on a compassionate access drug, the transition into commercial use is quite seamless. So I hope that my experience will be replicated for any of you that are looking ahead to that.
Thank you. Thank you so much, Christina. Thank you.